Could I please have Charlene Adonis? Folder 41. Hi, Charlene. I'm Sister Olivier. Is it okay if I call you Charlene?
Yes,
okay.
thank you.
Please follow me this way so we can talk more privately. So how was it getting to the clinic this morning?
I'm quite tired, and it was quite a long journey. I had to try and help get someone to help me with this.
Sure, Charlene, it sounds like it's been quite a difficult morning. Hey? So we will discuss some of those things later, but for now, if you can maybe begin with your medical history. So if it's okay with you, I would just like to ask you some questions about how you are feeling, and this will really help me think about the best way to support your wellness.
Okay, but these questions that I answer, are you going to tell anybody about it?
Okay, so you don't have to answer anything that you're not comfortable with. Okay, so all your health information is confidential, except if I am worried that you are a danger to yourself or to others, I will need to tell somebody so that we can keep you safe. If I can start with the first question. Have you on some days or most days felt unable to stop worrying or thinking too much?
Well, I am thinking too much sort of about how I'm going to support the baby, with like food, clothes, all those things. And like I'm sort of worried that my boyfriend might just leave me. So these are some of the things I'm scared about.
Yeah, I understand this can be a very difficult time and it can feel, like it's too much. Okay. So, Charlene, in the last 2 weeks, have you on some days or most days felt down or depressed or hopeless?
I've noticed that like my body feels very heavy and like my head is just full of thoughts. Like I'm just thinking all the time.
It sounds very difficult. And also, it doesn't sound like you're spending time with family and friends. So many women struggle with these sad feelings and too much worry during pregnancy. But you know what's amazing is that even though you had such a difficult night and morning, you still came for your clinic appointment. And for me, that's really great. So well done. Yeah. So just the last of the questions, Charlene. In the last 2 weeks, have you on some days or most days had thoughts and plans to harm yourself or kill yourself?
No. I would never do that.
It does sound like you are struggling with your thoughts and your feelings and how you are doing things. Okay. And we know that when women have extra support, that it helps them, to manage tougher situations. It also gives them a sense of just how strong and resilient they are. Okay, so here at our clinic, we have Dr. Habani, and she sees our maternity unit patients on Wednesdays, and she's really good at listening. Okay, then we also have a counselor who works at the Community Health Center just here in Protea Street, and she's there on Tuesdays and Thursdays, and that's free of charge. Okay. In addition to that, we also have a support group for women at the church. It's not far from here, and that's also free of charge. And you don't have to belong to the church in order to be part of that group. Okay. What do you think about these options? What are your thoughts? Do you have any concerns?
What would happen with the counselor? I mean,
together the two of you will sort of talk about or learn more about mental health issues. Together you'll think about what is most important and think of a plan to help you deal with these difficult situations.
Okay. So maybe I could go see her.
It sounds like a really good idea. No? So I know I've spoken quite a bit, and I just need to make sure that I've explained everything to you clearly. So if it's okay with you, can you maybe just, describe to me what we've talked about so far?
Okay, well, you mentioned that if I do go through with this, that she's gonna help me like process things, help me to get better and stronger, and like the mental health stuff, she'll help with that also.
Yeah. Yes, so exactly. So we really just want to support you to feel better. Okay. Are you sure I can't make an appointment with you for days?
Okay, maybe let's try. Let's see, maybe for Thursday, and then I can get my sister to watch my child.
Okay.